This module will focus on one of the core ethical responsibilities for doctors, respecting patient autonomy through the process of valid, informed consent. Autonomy, or self-determination, is a fundamental principle that gives patients the right to make voluntary decisions about their own healthcare. We will explore what informed consent means in practice and its legal basis, components of a valid consent process and documentation, applying consent standards in various clinical contexts, specific considerations around children, mental capacity and consent, challenges that can arise, and strategies for enabling truly autonomous choices. By the end of this module, learners will understand why patient autonomy is so important in medical ethics, legal and professional standards for informed consent, how to conduct a consent discussion and complete the required paperwork, practical scenarios where consent can be complex to navigate respectfully. Respect for autonomy has roots in ancient philosophical traditions, but gained prominence with modern rights-based thinking. In healthcare, it emerged as a key issue alongside developments like organ transplantation, surgery, research ethics, and reproductive technology. The 1947 Nuremberg Code first outlined requirements for voluntary and informed consent in human subjects research after Nazi experiments. In the UK, the 1957 case of Sidaway versus Board of Governors established judicial precedent confirming doctors' duty to discuss material risks with patients. Consent promotes individual well-being, trust in the doctor-patient relationship, and aligns with principles of patient-centered care. It signals to patients their values and goals matter most when making treatment decisions. However, it also serves a public function by demanding healthcare providers disclose pertinent facts. Today, consent standards are entrenched in medical ethics guidelines and domestic laws. The UK 5 safety tests establish its legal basis requiring consent be voluntary, patient have capacity, receive sufficient information, and consent is appropriately documented. Failure to meet these criteria may constitute negligence, battery, or trespass against the person. Informed consent involves providing patients factual information about their condition, treatment options, and material risks, benefits in an unbiased, understandable manner, explaining the purpose of any proposed intervention, what it involves, and how it may affect their life, answering questions to the best of the doctor's ability, and checking understanding before consenting, respecting the right of patients to weigh options according to their own values, priorities, lifestyle, and circumstances, rather than telling them what to do. Documenting consent in medical records with patient's signature or mark as an agreement has been reached. For consent to be legally and ethically sound, the following steps should be addressed in the process. 1. Capacity assessment. Is the patient mentally competent to understand information provided to make an informed choice? Any doubts would require further evaluation. 2. Disclosure of information. In everyday language, explain the basic nature of the condition and treatment options, what each procedure involves, material risks, benefits, likelihood of success, alternative options including doing nothing. 3. Recommendation. Doctors may provide recommendation to guide decisions, but cannot undermine autonomy by insisting on treatment preference without clinical or ethical reason. 4. Comprehension check. Ask open questions to ensure key facts are understood before consenting, rather than just checking boxes to get patients out the door. Address any misconceptions clearly. 5. Voluntariness. Consent is freely given without pressure or coercion, which can invalidate consent even if paperwork is complete. 6. Documentation. Signed witnessed consent form or equivalent in records clearly specifies what consent was given to and outcome of discussion for future reference. Mrs. Ahmed, 74, presents with breast lump and is found to have stage 1 breast cancer after biopsy. Her oncologist, Dr. Patel, explains options are surgery alone or surgery plus chemotherapy to reduce risk of recurrence. Dr. Patel details what surgery involves resection under general anesthetic with scar, 95% 5-year survival without spread. Chemo treatment plan, 4 cycles, common side effects like fatigue, nausea, but adherence improves outcomes. Success rate to 98% cancer-free. Q&A covers risks of anesthetic complications, lower risk of other primary with chemo, fertility concerns addressed. Mrs. Ahmed understands and values peace of mind, so opts for surgery plus chemo. Consent form specifies treatments and is signed. Certain contexts require sensitivity to individual circumstances. Children and young people, under 16, parents provide consent unless deemed competent, Gillick competent. Doctors must consider child's views based on understanding. Over 16 can consent alone. Mental capacity. For those with impaired decision-making, the principle of best interests replaces autonomy in a aligned way with preferences known or assumed. Relatives cannot consent against a person's valid expressed wish. It would require Mental Capacity Act processes. Emergencies. Consent is implied for immediate life-saving interventions, but ideal to reconsent when stable. Exceptions exist, like Jehovah's Witnesses' blood transfusions, where advanced directives must be followed. Research requires written informed consent involving information sheets, time for reflection. Withdrawal must be possible without repercussions. End of life. Earlier open discussions help establish preferences for future care, allowing family input when incapacitated. Advanced care planning helps ensure autonomy over choices if situation changes. Personal relationships. Patients consenting to doctor, partner, or family member's care requires extra care documentation and oversight to minimize coercion concerns. While consent aims to be straightforward in principle, situations challenging respect for autonomy can arise requiring tact and diplomacy. Some examples: patients pressured by family to accept risky options against wishes due to emotional financial leverage, which may invalidate consent. Respectfully addressing this dynamic is important. Those who aggressively second-guess medical advice and refuse treatments doctors deem necessary may benefit from additional independent opinion or mediation. Find shared understanding. Doctors concerned consent was not truly informed or voluntary have duty to re-explore rather than proceeding, even if consent form signed. Communication barriers. If patient does not share doctor's language, require impartial interpreters to avoid potential misunderstandings. Some patients prefer not receiving full facts to avoid feeling anxious. While autonomy allows this choice, practitioners balance openness with avoiding non-therapeutic harm. Valid informed consent lies at the heart of medical ethics and the doctor-patient relationship. While complex in practice, remaining anchored in patient autonomy as the guiding principle assists ethical decision-making when navigating complex real-world scenarios. This module explored legal and professional standards for consent, as well as practical strategies and specific considerations to optimize respect for individual choices. Understanding duties to disclosure, capacity, and voluntary participation empowers respectful discussions, enhancing patient well-being and trust in healthcare.